Okay guys, in this new video today we are going to discuss another breast plan, but this time we will also treat the SCF nodes, because cancer can spread from lymph nodes and these are very important to treat. So that's why. So this plan is different than the plan we discussed before. So here we have a Monaco platform and we have several different cases. So we will go to our patient breast TRN. Okay, so I will create a new Monaco plan. So I will come here on the left side of this platform of Monaco. I will click new Monaco plan, and I have shown this earlier. So let's give it another name. Let's call this Muhammad A. And let's select this, and now I will like to work with variant 120 MILTRN. Other than that, map machine is okay. Modality, we want to treat breast cancer with photon. We have algorithm Monte Carlo. Energy is 6 MV, and this. So I have worked on it and I figured out these are the best location for the ISO center. So let's put this 7 and 18.5. But this will depend on case basis. You will have to figure this out. Okay, so this is awesome. Now we come here and we maximize it. Once this is maximized, we go to beam, we set. So here you are seeing that so for gantry angle we should be working here, so we should maximize this. Okay, let's go to the beam. So here we are seeing a beam that is turned on. We need to give it a proper angle, right? So this is not the good angle. So I give the gantry the good angle that I have worked out, and that is 30. Where is it? It's 308 degree. That is the good angle. And okay, so this is not good. This is a good angle. Okay, and how about this? I need to also, okay, now after this, now you can see the gantry angle is good. Now we go back to the maximum view. Okay, so this gantry angle is good. Now what we want to do, we want to set the geometry of the beam to treat this breast cancer patient. So I click here asymmetric. So remember that we are working on beam. So beam you can see from here. I am clicking asymmetric, and now I click width. So what width I give? For 1 I give it 0, for 2 I give 10, for 1 length I give 0, for length 2 I give 19, and that is perfect. So now you can see our region is totally covered. Now breast, like we discussed before, we need two beams, two exact opposite beams. So we once again come here. Okay, we go to the plan, we go to the new beam. We don't click to the duplicate beam. We want duplicate and opposite beam. So here you can see another duplicate and opposite beam have shown up. It's the advantage of this technique is you will not have to set once again these gantry parameter like angle of rotation, width, and all other stuff. So you have saved your time. And now you go to the prescription. So what we want to do with the prescription? Once again, we want to give patient 5000 centigrade in 25 fraction. So this is good. Here you are seeing plan isocenter. Okay, we are working with breast PTV evaluation. So this is good. Now we are good to have it. Okay, so far so good. Now what we want to do, we want to make a beam that will treat SCF, or this node where the cancer can spread to the other part of the body. So how we will do this? So we will come to the prescription. We have add RX. We go and click add RX. We see like here in our case 4 templates open. We click the second one because we only want one beam. We don't want 2 beams, right? So we click this one. Now once again we need to work with the same machine. So we click variant 120 and map machine, modality photon, Monte Carlo, energy 6 MV, volume isocenter. Now we also need to give the same isocenter location that we were working on earlier, and it was basically 7 and 18.5. So this is awesome. After this we are good. We just click OK, and now we once again come here, we maximize this. Okay, now we will work on the beam geometry. So what we will do, once again we will come to the beam, right? We will come to the beam. Okay, now we give it the gantry, the angle. I have seen that 346 was the good angle, so I will give it 346, and I will once again select asymmetric. So let's select asymmetric, and I give the parameter that is width 1 is 7 and width 2 is 0. With length 1 is 7 and length 2 is 0, and this will make it perfect. I think I am doing something wrong. 1 minute. Okay, yeah, this has worked. Awesome. Great. Okay, we need to also set its prescription. Okay, so plan isocenter is as center of SC. This should fix this problem. And here we are giving 5000 centigrade, not 200 centigrade, in 25 fraction. So this is awesome. Okay, now what we should work, we can also give it DVH statistics, because there are certain restriction that we can give dose to one organ. So like for breast PTV plan, we have dose dosimetry criteria, and that is D95% should be greater than 95% of the dose. Okay, this is good. So I have this. So I have 95% volume of the breast should get 4750. That is 95%. Okay, D95% should be greater than 4750 centigrade. What does this mean? This means that the breast that we are treating should get 95% of the maximum dose to the 95% of the volume. This is awesome. We have set one criteria. Now we set criteria for the heart. Okay, for the heart we have, so for the heart we have that 2500 centigrade should be given to the lesser than 10% of the volume. So we have this one, 2500 500 centigrade should be given to the less than 10% volume. So here you can see we have fixed this. Okay, now we go towards the total lung. So for the total lungs, we have D mean should be smaller than 1500 centigrade. So mean dose. So we have mean dose upper limit 1500 centigrade. Awesome, we have fixed it. We also need to work with the ipsilateral lung, the lung that is directly below the cancerous breast of the woman. So let's work with it. And for that we have V2000 centigrade should be lesser than 20%. Ipsilateral lung. So ipsilateral lung 2000 centigrade, right? Should be given to the lesser than 20% of the volume. So okay, now we can go and check it. So these are the restriction of the dose given to these organs at risk. Breast PTV evaluation, heart, ipsilateral lung, and total lung. So this is awesome. We have done good work. Now we have a structure, we have prescription, we have done everything. With this, now we go to set our MLCs. For that, let's come first to, or okay, let's work with B. Okay, now I come here, I go to the planning, I come here. Okay, so here I have SC, good. So I give it 0.4. So the margin I have given 0.4, and here you can see it's okay. So let's select close, and now I work with the other beams. So I work with beam A. Okay, so which one is this? Let's see it. Okay, we are working with lateral one. So let's go, and we can even give it a name. Let's call it LA. Okay, and we call this one, or let it stay AP. So okay, for the lateral one, what we are going to do, we are going to set an MLC there. For that, we go here, we select breast PTV evaluation, let's keep 1 centimeter margin, I think. Let's see. Okay, so because heart is a very sensitive organ, we need to be careful about heart. So let's see the heart, if we can do something to save our heart. So let's somehow work with MLCs. We can do slightly better with the heart. We want to save this woman's heart. Okay. By that I only mean, yeah, but we do not want to like collide with the, yeah, no. Good. Okay, I will say let's work with it. Okay, I will say let's close. Okay, now we set MLC for the other one. Okay, so for that, once again we go to the planning, we click create and edit parts, and I click breast PTV evaluation, and I put here 1 centimeter margin, and I click this one. Let's see where it's going. Okay, so I think I should do something about saving heart. Let's see. I do not want to like also collide with the boundaries. I think that's okay. Okay, I think that's okay. Let's close it. Okay, now we have even set our MLCs. Let's calculate our plan. Let's do this. Okay, now I come to the I need to set this. That is such a big mistake. 50%. Okay, now this is good, this is awesome. Now I come here, I fix this to 5000 centigrade. I usually work with isofill. You can work with whatever you want. Okay, so all off, only this one on, this one solid. Let's do 116, and we also need to do something more. Yeah, rescale it to 4750 to cover. Right now we are working with the breast, we are not working with SCF. Okay, those 95% of the breast should be given 95% of the dose. That's what we are doing. So we are giving breast PTV evaluation. This is awesome. Okay, and we can in actual okay, and we need also to work with beam B, the beam that is given to the nodes. Okay, now I need to go back in actual to so I need to come there, I need to maximize it, I need to work with I need to go up. Up. Okay, so this is good, this is good. Or we can use this one, maybe use this one, right? Okay, here I will pick a point at 2.5 centimeter from the skin surface, and I will set this as a normalization point for the dose for beam B. For that I need to come to the tools, I need to select Meyer tool, I come here. Okay, this one is good, this one is good. See the skin surface. Okay, I go there. Okay, let's do this. Oh no, this is too much, this is too much. This way I will not be able to calculate any dose. Wow, this was not a good point, I guess. Okay, I am not accepting this. I think let's work with 2.86. Okay, let's work with this, and no interest point and marker. Click this, it comes here. Now you pick this point, it will add a point that's called I8. Okay, you click done. Okay, now you come here and you say rescale to, you click this one. Okay, 1 minute, let's go once again to this view, and let's come here and why is it not clicked? 1 minute. Okay, now I do what? I come here, I do dose at a point, and where? Let's, because we have set I8, so let's select point of interest point is I8, and this is our reference point. Awesome and great. Now let's see our DVH statistics. Okay, fortunately everything have passed the criteria. Otherwise we were going to work with this setting MLCs and doing segments like we can do for some of them. Let's go to the A, and here we see 160 gray is given to this region. We can like block it so that those can be like good. So like what we can do here, we come to the segment, we click copy segment, and we go up here, we click this, and MLCs are open, and now we take the pencil tool and we do this, boom, and this is blocked and this is applied, and you click close. Awesome. Similarly you can do, okay, now you will have to do the calculation again. You come here, you click calculate. Okay, after the calculation is done, you come to the prescription. Once again you will have to do this rescale 4750 to cover 95% of breast PTV evaluation. Awesome. And now you can see here very less is there, so very less hot spots are there. And now if you go to the structure or DVH statistics, all the criteria are satisfied. We are doing very good plan. Okay, now here this is our DVH curve. Okay, so this is awesome. Okay guys, see you next time for another good plan.